Earlier again, this is Monday morning quarterbacking. That word quarterback came up because one of the contractors, Cheryl Campbell, said in her words, HHS is, quote, the quarterback on this project and is the ultimate responsible party. So my question is, all these allegations going back and forth, who knew what when? I know you want to detail every last one. But to be clear, is Secretary Sebelius the responsible party? Is she the quarterback for these mistakes? I understand contractors made mistakes, but ultimately, is the HHS Secretary responsible? Is the President responsible? Who in this administration is responsible?
Well, the President spoke very clearly from the Rose Garden about the fact that he is wholly unsatisfied with
But is he responsible?
Look, this is. I've said, this is on us, and that goes from the President on down. This website needs to work effectively for the American people, and we need to get the product they so clearly desire to them as efficiently and effectively as possible. That's why we're working as hard as we can to resolve these issues and improve the consumer experience on healthcare.gov. And as we do that, we are building capacity through the other avenues by which people can shop and enroll. That includes by phone, through the call-in centers, in person, or by mail. But we're at this every day because, yes, this is something the President fought hard for, and he believes it is absolutely vital that those millions of Americans who have lived with the uncertainty of not having coverage for so long have these options available to them. And as I noted earlier, while there have been problems, and they have been significant, and they have not been by any means acceptable, from October 1st, Americans have been shopping, applying, and enrolling in the Affordable Care Act in the marketplaces.
Two other quick things on this. Specifically, I haven't heard you ask yet. I know you attacked Republicans earlier and said that there are folks who want to dismantle the law, who are trying to change it and disguise it as a delay. But there are also, you have to acknowledge now, a significant number of Senate Democrats, at least 5 or 6, who want some kind of changes. And to be absolutely clear, they're not saying they want to defund the law. They're not saying they want to kill the law. They're saying they want to make it better. But they do want to change it. And so my question is, you talked about responsible change to the law to make it better. Is this proposal that various Senate Democrats have said extend open enrollment beyond March 31st? Yes or no? Does the White House support it?
Well, here's what I would say, Ed. We're 3.5 weeks into a 6-month process. The open enrollment period was 6 months for a reason, which was to give ample time, as these marketplaces were launched, for Americans to shop for health insurance, evaluate their options, find out what tax subsidies are available to them if they're lower income, and then make their decision about the kind of coverage they can afford and want for them and their family. And we're still early in that process. And what is important to remember is that, as I said earlier, people are getting through. They are shopping. They are applying. I think we said the other day roughly 500,000 people have submitted applications. I'm sure that number is higher now. And we're going to work every day to make the consumer experience better. And March 31st is still a significant ways away, and we are working to make the system better. The system was inadequate, the website anyway, on October 1st, unquestionably. And it's still not where we need it to be today, by any means. But it is significantly better today than it was a week ago and a week before that, and certainly on October 1st. And that's the progress we're looking for. I think I used the go-to sports analogy that this is 3 yards in a cloud of dust every day. But that means moving forward, and that means improvements every day that will help Americans get the information they need so they can get the insurance they deserve.
Third one, right?
No, in fact, you have 4 downs, and you get a first down.
And
then you score a touchdown.
All right, last one. You have also said from this podium, let's not just focus on the website. Let's focus on the substance. So I'm sure you saw the front page of the New York Times saying they did a review, and they found that the law is, in their words, failing to lower prices in rural areas all around the country. And they say that poor people are, quote, often paying more as they sign up, or will be paying more as they sign up. And so my question is, you've said so many times that the law was intended to help so many people, and the New York Times is suggesting the people you're trying to help actually are going to pay more. So is that not a broken promise?
Let's be clear. Under the Affordable Care Act, nearly all consumers, about 95%, will have a choice of 2 or more health insurance issuers. often many more. And nearly all consumers, about 95%, live in states with average premiums below earlier estimates. In the marketplace, new rating and benefit rules, along with bans on pre-existing exclusions, allow insurers to compete for customers based on price and quality. The individual market has long been dominated by one or two carriers, particularly in rural areas. So this is a problem that significantly pre-exists the Affordable Care Act. The ACA encourages competition and is leading to new carriers and delivery system models, but we know that we can't transform these markets overnight. Prior to the ACA, many individuals had no access to coverage because they were denied coverage due to a pre-existing condition or priced out of the market entirely. Individuals will have an average of 53 qualified health plan choices in states where HHS will fully or partially run the marketplace. On average, premiums before tax credits will be more than 16% lower than projected. 6 out of 10 people could be eligible for coverage that is less than $100 from new options created by the Affordable Care Act. So, you know, I understand the question, and I story. This is a challenge that the Affordable Care Act is designed to address, and it is addressing it. And we're going to keep working on making sure that individuals across the country that have not had access to affordable health insurance have that access. And as I've said, you know, 95% of all consumers live in states with premiums, average premiums that are below earlier estimates. And you know, this is within a broader context, as I've noted, in which we have seen over the 3 years since the Affordable Care Act was passed into law, and Republicans and opponents of it said that it would jack up growth rates and health care prices. We've seen the opposite. We've seen the slowest rate of growth